Hi there, my name's Melissa, and today I am bringing you a presentation as part of our pelvic pain and endometriosis clinic at Northside Health NP. Today's presentation is related to the brain and pain, so looking at managing the impacts of persistent pelvic pain from a psychological perspective. A little about me. Melissa Harding, I'm an educational and developmental psychologist. I've been working as a therapist since 2014 across many different spaces, private practice, not-for-profit, schools and tertiary mental health. My work is across the lifespan, more recently as part of Northside Health, working predominantly with adults, some teens as well. I support clients with a range of presentations, typical anxiety, depression, but as well as trauma, including complex and attachment trauma, neurodivergence, and of course, persistent pelvic pain and chronic pain. Currently, I work via telehealth. I was up in Darwin until the end of last year, and so now all my sessions are provided online. Before we get started, I do want to acknowledge the traditional custodians of the land on which we meet and their ancestors. I acknowledge and affirm the cultural, spiritual, and religious practices of Aboriginal and Torres Strait Islander people, and I extend my gratitude to the healers and teachers in our surrounding communities and value their contributions to health and healing. I am currently in central Queensland, and so I am coming to you from Gungaloo country. A little bit of an overview. So for today, my hope is to go through a bit of an introduction, understanding persistent pelvic pain and the interplay of mental health, pain pathways, brain systems, and mood, and then of course the impacts and management. Hoping to speak for about 40 minutes, give or take. We'll see how I go. So first things first is our understanding of persistent pelvic pain. Now, there are many different types of pain. We've got acute, chronic, nociceptive, neuropathic, so many different terms. And it can be really confusing to know what people are talking about and what they all mean. Now, if you are wanting to understand more about the different terms and the different types of pain, have a chat to one of our wonderful physios, or of course, research. ChatGPT can be very, very helpful in helping to really conceptualize what certain things are and what they mean. For me, the point of today's presentation is not to go through the different types of pain, but really to highlight that there is more than one type of pain. Now, chronic pelvic pain or persistent pelvic pain is classified as pain in the area of the pelvis that's been present most days for more than 6 months. It's estimated that around 20 to 25% of Australian women will experience persistent pelvic pain. And I want to really highlight too that although pain may have begun in the pelvis, we know that persistent pelvic pain can be experienced in so many more spaces than that. Now, chronic pain and persistent pelvic pain are not the same, though sometimes you'll hear people talk about them in a very interchangeable way. I want to really preface that while we know that they are not the same, that they have their own kind of intricacies, persistent pelvic pain has its own differences and nuances. Unfortunately, the research that we have and the information that we have about particularly mental health and pain, a lot of that comes from our understanding of chronic pain. So, what I'm kind of sharing with you today is essentially drawing from what we know about mental health and chronic pain and making inferences about that in the pelvic pain space. Looking at the brain pain connection, we know that pain is processed in the brain. And because of this, it's influenced by and influences other brain based experiences. These can include stress, mood, attitudes, trauma. And we know that the brain's ability to do what it needs to do will be impacted by pain too. So, an example of this can be our mental clarity, our resilience, our attention, and our ability to engage and communicate with other people. Now, pain being processed in the brain is maybe a simplified way of understanding the way in which our brain understands and our body understands pain, it is really complex, that there is so much more than just our brain involved. However, I think it is really important to acknowledge the understanding of what's going on in our brain, as well as what's happening both in our nervous system and in the way in which signals are sent. I like this image as it really helps us to understand some differences between our understanding of acute pain and chronic pain, and what we know about brain's activation when these things are experienced. So you can see here from this image that in a brain that's experiencing acute pain, around 5% of the nerve cells in the brain are processing that. Over here, we have chronic pain, and you can see that what's highlighted is so much more than what's happening over here with the acute pain. So in a persistent pelvic pain brain, we're seeing around 15 to 25% of the entire brain being involved in that. So what we know is that it's so much more than what's experienced in an acute sense. And what we're seeing here is the activation in so many different regions, which really ties into that understanding of, it's the things that are being activated, the things that are being influenced when we're experiencing chronic pain are really so much more and are going to be impacting our brain in a different way as well. The other really important factor is that when we're experiencing acute pain, it's predominantly physical. It's a kind of physical experience, and that's our understanding of what's going on. When we look at chronic pain, it's so much more than just physical, that all these areas of activation are also looking at the emotional and cognitive experience of that. Some of you may be across the biopsychosocial model. I am sorry that my face seems to be cutting off the bottom here. I'm going to go back and re-record this, so hopefully we can make sense of it with me being in the way. But essentially the biopsychosocial model is an understanding that hopefully all healthcare professionals will be across, but it's the way in which we might conceptualize an experience. And so I'm going to apply it here to our experience of persistent pelvic pain. And so down here we have the biomedical and what's hidden over here is psychological. And so if we look at the biomedical understandings of persistent pelvic pain, we look at history. So things like injury, if we've experienced injury in that area, trauma, medical conditions like endometriosis, adenomyosis, and then the pathology and physiology as well. So these are things like inflammation, neuroplasticity. We look at the biopsycho component. So psychological is over here where we've got our psychological states and traits. So these are things like anxiety, depression, neurodiversity, those different brain types and how our brain works, and of course fear of our pain. And then cognitive factors, which includes our interpretation of pain. Up here we've got social, and this looks at things like what our occupation is, whether we're in the workforce or if we're a student, family roles, relationships, and of course societal expectations. Over here, when we look at the biomedical underpinnings within this model, things like ACEs, which stands for Adverse Childhood Experiences, these are things like trauma. And so if we've experienced childhood trauma, that's going to be influencing this model and our experience of pain. Now, often when we think of biomedical, we think of medical and we think of doctors and, perhaps specialists that you've seen. But it's really important to acknowledge that medical system is also a factor over here when we look at societal expectations or social influences of persistent pelvic pain. Now, people might be at a different space in terms of their understanding of the biopsychosocial model. If you have never had contact with a physio or a psychologist or anyone within the mental health space, you may be really across this biomedical or medicalized understanding of your experience of persistent pelvic pain, but perhaps haven't necessarily come across the both psychological and social implications as well. And so many will have experienced or navigated their pain through these kind of circled spaces. And what's really important, and I guess what I'm hoping to share here is that your experience is so much more than just the medical understanding of that or the medical management of that. Now, think back to the brain, the way in which it's activated. Remember that 15 to 25% of the cells, that is not just medical. That in a chronic pain space, we're seeing rewiring of neural pathways. And this is where, you may have come across the understanding of central sensitization. So the way in which we might become more sensitive to pain. And so things that may have previously not been painful are now experienced as painful. And this can be things like bloating and physical touch. Essentially, our brain becomes hyper alert because of all this activation that's occurred over an extended period of time. If we think of things only medically, we're really doing an injustice to both those emotional and cognitive implications of our experience of pain too. Now, a way in which we might conceptualize this or understand this is through the HPA axis. So this is our hypothalamic pituitary adrenal axis. And this is going to get a little bit jargony for a moment, but I promise that there is a point. So essentially, we've got our hypothalamus, which is up here in our brain, and this detects stress and releases a particular hormone, our CRH hormone. It then sends messages to the pituitary gland, which is below the brain, and responds to the hormone that's released by our hypothalamus. So we're seeing like a bit of a flow-on effect. Our adrenal glands sit on the top of our kidneys, so a bit down further, and they respond to what our pituitary gland is releasing by releasing its cortisol, and this is the main stress hormone. And then we see this action of things kind of coming back up. In short, the HPA axis helps the body to adapt to stress. If it's overactive or dysregulated, and this often occurs when we experience chronic stress or pain, so then we think of stress in the psychological or physical pain space, we get this sense of dysregulation at play. A bit of an analogy that can be helpful when we're understanding the HPA axis is to imagine it like a fire alarm system. So our hypothalamus is our smoke detector. It's scanning for danger. If stress is detected, it's sounding an alarm. Our pituitary gland, which is our alarm control panel, it receives the signal from the smoke detector, sends out instructions to activate the emergency response. And then our adrenal glands are our firefighters. So they respond by releasing cortisol and adrenaline, the emergency crew of the body. These help fight the fire, so cope with stress, and increased heart rate, alertness, and energy are at play. Now, in a non-chronic stress system, once the danger passes, the system shuts off that smoke detector and the firefighters go back to the station. In a chronic stress system, the smoke detector becomes hypersensitive. It's always on alert, looking for danger, even if there is no fire. Our firefighters are doing their thing, but they're exhausted, and this causes wear and tear on our body and our brain. So if we look at the impacts of this, over an extended period of time when our fire alarm system is becoming hypersensitive and overactive, we can experience things like extreme fatigue. And we see this pop up particularly after a flare or if we've had surgery. We can have worsening pain, so our body can get stuck in this heightened state of threat detection. And this, I suppose feeds into that idea of central sensitization as well. We can have immune and inflammation impacts. Disrupted sleep, our appetite can be impacted, our mood, and of course we know that there are changes in the brain. So the stress circuitry remodels itself when it's stuck in that overdrive. There are some other terms that can help us understand this, and so this can also be known as adrenal fatigue, burnout, boom and bust cycles, chronic fatigue, HPA axis dysregulation. Boom and bust cycles may be something that you have heard or come across. And so when we look at boom and bust cycles, the way in which we conceptualize this or understand this is that we know that there are good days and bad days, that these are really common. And so on good days, we might overdo it and we might push ourselves too far. And then this results in us meeting our pain threshold, which then may result in more intense bad days and a need for rest. So rest. rest for hours, for days, for weeks. We feel good and we push ourselves. And so what we're seeing at play here is this cycle of overactivity, crash, reduced capacity, overactivity. And this goes around and around. The more we push, the longer our recovery. So this graph can help us understand what's happening with that overactivity. So looking at this idea of pacing, it's like if we look at our activity level here, we have a good day, so we boom, and then we have that inevitable bust as we boom and we bust. And what we're seeing at play here is this gradual decline in our activity and our capacity. And the hope is that through pacing, we can see this change in the activity level. So this idea of, starting with a baseline and gradually building up, but really trying to change that approach to pushing beyond our capacity and then engaging in that, exerting too much activity and then the eventual crash. When we look at pacing, it's really important to know that while this might seem really straightforward in this presentation, it takes practice. It's not something that necessarily will come naturally to us, particularly if we've been in that overactivity, reduced capacity crash cycle. It's going to be really intentional and really important that we prioritize regular input so that we can engage in this idea of pacing. And so things like boundaries, self-compassion over self-criticism, these are things that can be really important when we're thinking about pacing. The goal is to move away from crisis management and into a space of self-care. Basic self-care can look like the way in which we prioritize sleep, hydration, meals, mindfulness and relaxation, attuned movement. And so this can be something to chat to your physio about in terms of what that looks like for you. Spending time in nature and with pets, understanding concepts like spoon theory. And if spoon theory is not something that you've come across previously, I do really recommend looking into it because it can be a really nice way to understand, the way in which we might be expending our capacity in different spaces and then how we can actually protect that end pace. And of course, psychotherapy. So you might be thinking, great, Mel, sounds wonderful, but how? How do I actually do this? First things first, knowledge is power. When we know better, we can do better. And so my hope is through going through what I have so far, it's giving a bit of an insight into what's underpinning this. And yes, that might be a little bit in depth or a little bit jargony from a psychological or brain perspective. But if we think about the way in which the brain is lighting up, the way in which the brain is impacted, then it can be really helpful to understand why this is important, why we're wanting to look at things differently and see how we might be able to manage this. And so we know that when we look at pain science education, that evidence shows us knowing about our experience and understanding how pain is processed and the impactful ways in which this exists in our life really impacts and reduces how our pain is felt. Executive function is what we consider to be our higher level thinking skills. So what that looks like is here, we look at executive function. These are all the domains that are influencing our executive function. And these are things like planning and prioritizing, time management, working memory, self-regulation, task initiation. And we know that when we experience chronic pain, so many of these areas are impacted, but particularly so our working memory and our emotional control. So this might be that if we're experiencing a flare and we're trying to recall information, that we're finding it really hard to kind of reach for that and draw that to our conscious awareness. And I see this described with clients in the space of it feels so foggy, like I just don't feel like my brain is working in the way that I want it to be. We think about emotional control, this shows up in the sense of irritability and feeling like we're not actually able to manage our emotions while this is at play. Now, our executive function is really important. So it's that higher level thinking skill. It is also the kind of last developed part of our brain. So it's in our prefrontal cortex and doesn't fully develop until the age of around 25. And we think about these things and you think about them in children and you go, yeah, I know, like my child has trouble paying attention sometimes or regulating their emotions. And so, similarly, when we have other stuff going on in our brain, these are the areas that are not working to their best strength because our brain goes, actually, that's not as important. I'm going to use my resources on something else. So we think back to that HPA axis. It's when our brain is activated in a chronic pain sense, it's going, well, these are the things that are lighting up. These are the things that are really important. How I plan and prioritize my time is not something that I'm going to be focusing on right now. Prefacing the role of being a woman here, that as a woman, we hold most of the executive function responsibilities of a household. And so if we think about then if we have children or if we're working at the same time, that these are all things that require immense amounts of executive function. We also experience pain. This is stuff that you're going to be noticing and experiencing on a reasonably consistent basis. An analogy I quite like to use when considering our executive function, the ways in which we can feel that overwhelm and not know how to do all of the things while our brain feels like it's not working in the way that we want it to be, but also thinking about that idea of pacing and when we're not in that boom and bust cycle, is this idea of considering the balls that we're juggling at any point in time. So no matter what the point in time is, we're always juggling. And so we can think about, well, imagine that we're juggling glass balls and bouncy balls. If we drop a glass ball, it's fragile, and if it drops, it's going to break. And if we drop a bouncy ball, it will bounce. It's pretty resilient. And so sometimes it can be really hard to go, what's glass, what's bouncy? I am not sure. It all feels glass. And we have this boom of, everything's glass. I have to do all of the things, which can lead to that eventual crash. Things that are glass can be things like our health, our close relationships, being a parent, our emotional well-being, or of course essential work tasks. It's important to acknowledge that engaging in the workforce is often really necessary, and so that can be something that we really need to prioritize. Bouncy balls can be things like housework, engagement in social media, completing minor errands. We can't juggle everything at the same time all of the time. Our focus really needs to be on what are we juggling that's glass and what can we put down if it's bouncy. And this is a way of, I guess, describing that idea of pacing. Masking is a concept you may have come across before, and it's this idea of pretending that everything is okay even when it's not. Masking is both a conscious and an unconscious process. There are significant impacts to masking, and we know this within a mental health space in that it can be overwhelming and it's exhausting and it's not sustainable to mask all the time. It also can lead to a lack of understanding from others if we're constantly showing up and saying, I'm fine, everything's great. Even if it's not, others aren't going to understand when we're struggling. It can also lead to pushing beyond our capacity and, of course, fatigue. Masking, meet boom and bust cycles. One of the biggest struggles that I identify with people that I speak to within the pelvic pain space is this idea of self compassion. Self compassion is our ability to be kind, gentle, and understanding with ourselves. It looks like taking breaks before we're no longer able to focus at work. Think about those boom and bust cycles of that graph that I shared before. It's, when can I see that line and take a moment for myself rather than being in that space of increased activity or when I'm feeling so low that I actually need or am forced to take some time. Our ability to be self compassionate has been linked to a number of things. So, acceptance of our pain experience, which means a reduced catastrophizing of our pain or a lower intensity of that pain, too. It can help with improved emotional regulation and can lead to lower rates of anxiety, depression, and stress. Now, when I talk about acceptance, I'm not saying that we sit here and go, oh, well, it is what it is and everything is just going to be this way. It's more considering how can I accept that this is where things are at right now and be kind to myself and do the things that are really important to me. Again, but how? All sounds great. Now give me practical strategies. And so I shall. So, some management approaches I'm going to go through now are looking in different domains, both behavioral, psychological, sensory. And if we look at some of the behavioral based ways to manage persistent pelvic pain, think of the pacing. So, what can I tangibly put down? What can I go, I'm going to outsource that, or I'm not going to continue juggling that ball right now because it's resilient and it will bounce? Think about warm or comforting drinks, teas, hot chocolates, chais, whatever feels good for your body. Watching your favorite TV show or movie, listening to music. Thinking too about low prep meals, so those executive function demands, the planning and organizing. If we are in a flare, if we are in a bust, we may not have the capacity or the spoons to make a really elaborate meal. Are there ways in which I can think about future me or be kind to myself and go, I can't cook dinner tonight? Is it okay that we get takeout? Can I give myself permission to do that? Can I make myself meals and have those frozen? Can I make future me's life easier when I'm not in that space of bust or overwhelm and pre-cut snacks or have things that are easy to reach for that don't take too much planning or managing? Gentle crafting, and connection with others, with the preface here that it's okay to reach out to others without expecting a response or that you need to continue that conversation either. In terms of brain based or thought based ways to manage, thinking about the way in which we talk to ourselves and the way in which we might have this inner self-talk about our experience of pain. Now, I have no doubt that if I were to ask you to sit and think about all of the thoughts and feelings that you have about your experience, that you probably would come up with many that we would consider to be quite negative self-talk or perhaps wouldn't be in that space of self-compassion. And so this will be things like, I can't stand this pain, it's awful, I'm overwhelmed, there's nothing I can do, I miss out on everything. If I were to ask you instead to think of reframes, ways in which we can phrase these things and these experiences to ourselves, that's a little bit different, that's kind of not sitting so much in that doom and gloom. I imagine that that's much harder to do. So a reframe to that statement might be, I can deal with this pain. I've done it before and I can do it again. I have options to cope. It's really important that when we think about thought-based ways to manage our pain, it's that we identify what we're experiencing in that point in time and acknowledge the feelings associated to that before we reframe if we can. What can be really important here or important to acknowledge is that we don't want to move into this space of invalidating ourselves or this idea of toxic positivity where we go immediately from this feels really awful to, oh, but I'm so lucky that my legs still work or there's worse things that could be happening in my life or that others are experiencing. Those kinds of thoughts or reframes don't actually meet our need. They often invalidate our experience or they avoid the emotion that's attached to it. So it can be helpful for us to acknowledge that this is what's coming up for me and I can sit with the doom and gloom of that and also think about ways in which I can maybe challenge my thoughts or restructure them. That's going to be really helpful for me. Some examples that I've put together here are I'm having the thought that I can't cope, and that's just a thought. And as part of my experience, not all of it, I notice this pain. I can let it be here without letting it control me. My nervous system is sensitized. It's sounding a false alarm. My needs today are valid. Slowing down is strength, not failure. Mindfulness leans into what I was just saying about being aware of our current feeling state without judgment or interpretation. And so this can be things like saying to ourselves, where is my attention? Is this thought helpful? Or what am I feeling in my body and my mind right now? These can be things that we do anywhere and in any place. We can do them internally, just a little moment of self reflection. Things like deep breathing, body scans, gentle stretching. Deep breathing can be helpful, particularly if we're noticing that we're in this space of activation. Our body and our brain is in a threat response. It's going danger, danger. That fire alarm system is going off. To really bring back our awareness to where I am right now. And can I breathe into that? Try and really kind of, relax my shoulders, take some really big, deep breaths. It's important to know that mindfulness and meditation are not always synonymous. That for some people, meditation can be really hard, particularly if it's not a guided meditation or if we have this perception that we're going to block everything else out, that I'm not going to think about my pain or what's happening in my body. But that's not really what we're doing here. Mindfulness is more about considering what am I noticing at this time? What am I noticing is going through my mind? And am I able to see that and meet that without judgment and see what can I now do with that? What can I do in my mind and my body? Our physios and the Pelvic Pain Foundation Australia has some beautiful gentle stretching kind of pamphlets or handouts that can be really lovely and helpful. This idea of a body scan is kind of like what I was just talking about in the sense of really, and you might take a moment right now to just take a second to think about, well, where is my body and what am I doing with it right in this moment? So we want to start at the top of our head and go all the way down to the tips of our fingers and to our toes. And really just noticing kind of where is my body in space at the minute? Am I noticing that, oh, my neck does feel a little bit tight and can I do a little bit of a stretch to help with that? Are my shoulders really hunched? Are my arms kind of crossed over? And can I take a minute to just kind of uncross those and all the way down? Am I, picking my fingers or clenching my fists? And this idea of being mindful of what my body is doing and what need might that be meeting, but are there also things that I can do to really help kind of relax that and kind of, let that go? Some other management approaches can be sensory based. So you may naturally grab for sensory based adjustments or approaches. These can be things like using sensory tools, so fidgets. I've got the comb there. I've got a physio ball, which I think is kind of behind me, the yellow one that's up there. That, reaching for things that are going to feel good, our hands or in our body. The comb is one that I have in front of me, and it's essentially using a comb and having the teeth of the comb in our hand and really squeezing that. And that can be a really nice way of managing what's coming up in our body. It's something that we have control over. And it gives us something else to focus on if we're not able to manage any other kind of uncomfortable feeling that's coming up for us in our body. Again, these might be things that we do naturally without realizing that we're using sensory approaches to regulate our nervous system. So this can be where people kind of rub their legs, we might push on our fingers or kind of, the clenching of the fists, the playing with our fingers, picking at our nail beds or tensing our muscles. That these are things that we might commonly do to try and help manage what we're experiencing. Other things that can be helpful are lighting. Are we able to change the lights? So this might be that we turn off all the overhead lights, we have natural light, or maybe we want it dark when we put sunglasses on, even if we're indoors. Can we close the curtains? Think too about that tactile sensory approach, looking at, do I like a fluffy robe? Do I want to take my shoes off or have shoes on? Baggy clothes, tight clothes. Everybody is going to be different. And I think what's really important here is that what we might like at one particular time may not always serve us at all of the times either. So there might be times where we really want to have socks and shoes on and that feels really comfortable for us. And then there might be moments in which we want to take that off and we go, actually I can't stand the feeling of these clothes or these socks, and so I'm going to take that off. And that's okay. That it's okay if At times, our approaches or the way in which we manage our experience differs, and even if it contradicts itself, it's about what feels good for us in that moment and what we can do in that moment. Things like heated blankets, weight bags, warm showers, and of course, thinking too about smells and things that help comfort us around their herbal teas or essential oils that can really help as well. It would be remiss of me not to also talk about psychotherapy. Now, psychotherapy can absolutely be a really supportive and helpful approach to managing persistent pelvic pain. We think back to that biomedical model, it's looking at all of the psychological impacts of pain, and psychotherapy can help with managing the distress that we experience, the disabling aspects of having pain, and the impact of this on our daily living. Now, I've popped through I've put up here a couple of different therapeutic approaches, and these do have evidence to indicate that these particular therapies can be quite helpful. So, things like CBT, ACT, mindfulness based interventions, psychodynamic psychotherapy, and trauma informed therapies. What I will say is that the actual therapy is not the most important thing, and that not all therapy is the same or will align for every person. And so you may be someone that really likes CBT approaches, and that may be really beneficial for you, but that may not be the best for everybody. What's most important is finding a therapist that you feel really connected and safe with, someone that you feel comfortable with, and that you can have a shared goal for your therapy, and also one that understands you as a whole person. That again, thinking back to this biopsychosocial model, is that you are more than just one part of you. And so we know that there can be limitations to the support that we receive when we only focus on the medical, but there can also be limitations when we focus only on some part of the psychological. And this might be that we go to therapy to talk about our anxiety and we go, I'm just so anxious all of the time. But if our therapist either isn't aware or isn't able to support us in understanding how that shows up when we experience persistent pain, then there's a huge component that we're going to miss out. So, really finding someone that is the best fit for you is really, really important here. Thank you so much for your time today. I'm really appreciative. If you have any questions or if there's any follow up, please do reach out to Northside and they can help you out. Thank you.